The NHS over the last 5 years has had about 50% more in real terms than it had in 2002, which is broadly what we recommended in the first report. A lot of it's gone on staff, both more people, which is good, in fact more than we forecast in the report, but also on pay rises. That's a very mixed picture because it's not possible at this stage to see how much benefit the health service has got for the rises that have been paid. Really the jury's out in some of those areas and it doesn't look very promising. But also there's been some very good investment in equipment, in new premises, in information technologies where, although the story's not a great one by any means, and there's a lot of uncertainty, there are some good developments. Well, it's a very mixed picture, inevitably, because the health service is so large and so many aspects of it that there are some very good things that have happened over the last 5 years and there are some disappointing things. The good things are that if you look at life expectancy, for example, life expectancy is better. That's something to do with the health service and that improvement is growing quite sharply. There are more better treatments for some heart problems, cancers. Care looks better. We are catching up a bit, but still aren't caught up with other countries in terms of outcomes in those areas. We've got more staff, more even than we recommended in 2002. We've got some new buildings, we've got better medical technologies, more pharmaceutical support. There's generally a feel that resources have gone into those very important areas. So you can tick off some good points. The auditing structure of the health service, which we talked a lot about in 2002, that's also improved over the time. They've put in place, the health service, some quite significant changes in how the money flows in the system. We've given sort of question marks to them. We don't know. We think they're in the right direction, but they've taken such a long time to put in place. They've been very slow, very uncertain, that we think it needs longer. People are going to have to find out over the next few years how they go. There are also some real negatives that because of that slow, uncertain work, because of the structural changes that have happened so often and in some ways so inconsistently over the period, that's added to a sense that productivity improvement, use of the money hasn't been as good as it could have been. So big improvements, but some disappointing areas that need to get better. And on prevention, reasonable good progress. Cigarette smoking is coming down. It's more or less on that middle scenario that we painted, or even slightly better than that. Although inequalities are still made worse by smoking. Different types of people smoke with very different propensities at present. The big negative on public health is obesity, which is carried on rising for adults and for children through the period. When we did the 2002 report, there was a real difference by the end of the 20 years, depending on which of the three scenarios we were closest to. The danger is that if productivity is not very good and if prevention isn't good, that we finish up close to what we call the slow uptake scenario, which is very expensive, very much more expensive than the others. And also it just carries on rising. By the time we get to the 2020s, there'll be a very, very much larger number of old people in the UK, and the bill could really rise extremely sharply at that time. That's one of the reasons we put such emphasis on productivity and prevention, to try and make sure that that very sharp rise didn't happen through the next 15 years, so that we're in better shape to handle the rise when it's necessary. This sort of report should be done very regularly, in my opinion. We need to know what the costs are going to be in the medium term, 20 years seems about right, of healthcare and social care. Because if we do that, then we know roughly how many people need to be trained with very special skills. We know more about what sort of buildings we're going to need, what sort of technologies we're going to need, and also what the implications are in terms of who pays for them. All of those things will always require debate, often political debate. It's better if they're informed with independent assessments of how much is it likely to cost.